Hey, it's Adrienne. I'm back with another video. And this video is about things that have changed that has changed in nursing since I became a nurse. And I'm sure there's hundreds of things that has changed over the years since I became a nurse. So one of the things that has changed is written charting. We no longer do written charting. We use a system called Epic. And with Epic, physicians can enter orders anywhere on campus. They don't have to be on the unit where the patient is in order to enter orders. And it makes for room for less error. So the nurses don't have to try to figure out what the physician's ordering, and the patient has safer care. Another thing that has changed are manual blood pressure cuffs and manual O2 sat machines, pulse oximetries. So we now have digital equipment in the room, and they're mounted in the room. And so if it's a single room, there's one mounted in that room for that patient, or if it's a double room, there's two, one for each bed. So we no longer have to, like roll around the blood pressure cuffs to take blood pressures. We had advanced to what's called a Dynamap, the rolling Dynamaps. We no longer have to do that. We no longer have to roll around computers to each room, because once we did advance to computers, we would have the rolling computers, but we no longer have to do that. There are computers mounted in each room. We no longer have those like big back kind of TVs that patients used to have. Each patient has like a small flat screen that's mounted to their side of the room. We no longer have metal bedpans, which that was a thing. So there are now plastic disposable bedpans. When our residents would go over to do their VA rotations, they complained about, equipment over there and the conditions at the VA, which is very sad. These people, fought for our freedom, and they have the worst care ever, but that's a whole different video. And they came back and they said that they still used glass chest tube bottles. And we, even when I first started, did not use glass chest tube bottles, but I just found that crazy that they still did. We no longer have smoking areas on campus for our patients. We do not take patients down to smoke. I remember when I was in nursing school, my instructor said that as student nurses, they would have to, like, if the patients weren't able to, they would have to take the patients out to smoke, hold their cigarettes up for them to smoke. If they had a trach, they would hold their cigarettes to their trachs and smoke. Is that not crazy? That's something that we definitely, we don't do anymore. And like I said, there are hundreds of other things that we don't do in nursing anymore from when I first started. But comment in the comments, let me know what are some of the things for nurses, especially older nurses, that has changed since you became a nurse back in the day. And I'll talk to you later in the next video. Bye.